We had a little technology to work with when we started as a nurse, but now if I can bring in this project with the pilot study on the personal digital assistant, I know that this will enhance and improve nursing care and standards as well, because nurses will have at their fingertips the knowledge that we didn't have at that time.
Básicamente los problemas de salud en nuestro país son del tipo infeccioso.
A lot of our healthcare budget is focused on the prevention and treatment of chronic non-communicable diseases such as hypertension, diabetes, and HIV/AIDS. Some of the goals for the project at the time, I was told, was number one, to make information more accessible to nurses. Number two, to also empower nurses by increasing their knowledge base. And three, to collect information on HIV/AIDS. These goals were to be brought about by using the personal digital assistant, which is a small handheld computer, which basically functions as a desktop.
Well, we will be setting up, as part of our mandate, is to set up a wireless network within the area where the nurses will be working. So this wireless network will be able to receive and transmit to a standalone computer where the data collected will be stored. It will also provide the nurses the ability to access the internet with this remarkable PDA, to be able to go to Google, for example, to go to the medical handbook, the nurse's handbook, the drug handbook, to seek information. Those programs will also be on the PDA that will provide them access to it whilst they are not connected to the network.
Mi amor, ahí están los sigue buscando para atrás.
En la actualidad, las enfermeras nuestras, al igual que la de todo el país, en los hospitales tanto públicos y privados, carecen de información informática. O sea, no tienen acceso a la red de internet. Por lo tanto, los conocimientos que tienen son un poco obsoletos.
I remember an instance where I met a patient on my ward who had chorea. I had never before met the disorder. I asked my other colleagues, what is chorea? And they were uncertain also. So I had to go home and look up the disorder, and I realized it was an involuntary muscle disorder. If I had the technology at my hand, I would be able to look it up there and then and assess the patient's manifestations better.
Yes, the PDA will be there, accessible and available on hand to access that type of information. So it's really, really relevant, and we want to know that the information that we give is current and up to date and useful to the patient. And it can also help us in our day-to-day lives.
So we will be able to glean from their usage, those who use the PDA and those who do not. And therein lies the opportunity to make reasonable statements that a PDA, if used in a medical environment, can enhance the capacity of the users.
Allá. No, allá.
Me enseñó dónde se prende, dónde se puede escribir, me enseñó dónde yo puedo marcar una cita.
Tuve una experiencia muy bonita con la hija mía, ya que ella me dijo, mami, eso es un computador pequeño lo que tú tienes en tus manos. O sea que la misma facilidad de que te da la computadora que tú tienes en la casa que no has querido utilizar nunca, te va a dar ese aparatico, como ella me dijo.
¿Ya lo encontré?
Uy, espero muchísimas cosas porque por lo que estoy mirando nos va a ser de mucho beneficio a nosotras las enfermeras aquí en el hospital. Espero poder tener más contacto directamente con la tecnología y avanzar más en lo que es mi carrera como profesional y enfermera.
So really I hope that the process of the research, I hope it expands to the other nurses, it gets them on board, gets them using the technology and ultimately being able to improve patient care.